Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be doing another Kahoot, but we're going to be covering metabolic disorders and endocrine disorders. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video, subscribing to this channel if you haven't done so already, and don't forget, I'm offering next generation NCLEX reviews and one-on-one tutoring sessions. Now, my tutoring sessions book very quickly, like literally, I open the calendar and they book. So be sure to go to my website, nexusnursinginstitute.com. And if you don't see the day or time that works for you, keep checking. While you're there, don't forget to check out the audio lessons that I have available. Okay, guys, getting that out of the way, let's get started. Endocrine and metabolic disorders. Your patient is diagnosed with diabetes insipidus. Which symptoms are most indicative of this disorder? Would it be fatigue, diarrhea, polydipsia, or weight gain? Your patient has diabetes insipidus. Which symptom would be most indicative of this disorder? All right, good. Most of you guys chose the correct answer. It's going to be polydipsia. The patient's going to have excess thirst. Think about it. When the patient has diabetes insipidus, not to be confused with diabetes mellitus. When we're talking about diabetes mellitus, we're talking about hyperglycemia, high glucose in the blood. That's something completely different than diabetes insipidus. When we're talking about diabetes insipidus, we're talking about the patient that does not have enough ADH, anti-diuretic hormone. So this patient is urinating all over the place. They're getting rid of all of their fluids. So of course they're going to be thirsty. They're going to have polydipsia. That is the correct answer. Your ER admission is in Myxedema coma. Which should be your priority action? Would it be to warm the patient? Would it be to maintain the patient's airway? Would it be to administer thyroid hormone? Or would it be to administer fluid replacement? Your patient is in myxedema coma. What's going to be your priority nursing action? What do you guys think? Very good. Most of you guys chose maintain patient airway. Absolutely. Because who cares about the patient being warm? Who cares about giving them medication? Who cares about giving them fluids if they're dead? If they're not breathing, right? Who cares about anything else? So the main objective is what? To maintain patient airway. Now, when you're thinking of myxedema coma, I want you to think of hypo, as in down, hypothyroidism on crack. Hypothyroidism times 1,000. This is a medical emergency, right? This patient is in danger. Think about everything that happens during hypothyroidism, except much, much, much worse. So heart rate, down. Blood pressure, down. Cognition, down. Respirations, down. That's right. So our main objective, our priority before anything else, we got to make sure we keep our patient alive. Everything can come later. So yes, maintain patient airway. Very good, guys. Your patient with hyperthyroidism is prescribed PTU. Which would be a priority assessment? Would it be symptoms of pain? Would it be symptoms of renal toxicity? Would it be symptoms of hyperglycemia? Or would it be symptoms of hypothyroidism? What do you guys think? All right. So most of you guys chose the correct answer, symptoms of hypothyroidism, but I see that symptoms of renal toxicity was close behind. So let's talk about this because there's a couple things I want to point out to you, okay? As a test taker, you're not going to know every single medication. You're just not. So you need to use some context clues to help you figure out what's going on. Let's go back to this question. It says that your patient with hyperthyroidism is prescribed PTU. Let's say we did not know what PTU was, but at least let's hope you know what hyperthyroidism is. We know that that thyroid gland is overworking itself. This patient's metabolic rate is increased. Blood pressure is going to be up high through the roof. Heart rate is going to be high through the roof. GI tract high through the roof. Patient's going to have diarrhea, cognition, everything, right? High. We're giving them a medication to treat all of this highness. So what do you think can happen if we give that medication and it works a little bit too well? It'll do the opposite. Whenever you get a question and the question tells you you're about to give a medication or you just gave a medication, your answer is going to focus on the medication and not the disease process, okay? With that being said, we know that when a patient has hyperthyroidism, everything's up. We're giving them something to treat this, so obviously must do the opposite or at least bring it lower. We're going to watch out for that medication working a little bit too well and throwing them the opposite way into hypothyroidism. And that's for all meds across the board. So for example, if your patient has diabetes, right? You get a question, it tells you your patient has diabetes and you gave them insulin, what's going to be your priority concern? Your priority concern is not going to be hyperglycemia because hyperglycemia matches the diagnosis. Remember what I told you, when they give you a diagnosis and they give you a medication, you better answer your question according to the medication. What you're really going to be watching out for is what? Hypoglycemia, because if we give a patient insulin, that insulin may work a little bit too well and throw the patient on the other end and cause hypoglycemia. And that's how you're supposed to be thinking when you guys are answering these questions, okay? IV potassium chloride ordered for your dehydrated patient. Which would be your priority assessment? Would it be to obtain weight? Would it be to take the patient's temperature? Would it be to take their blood pressure? Or would it be to check the patient's urine? What would be your priority nursing assessment for the patient getting KCL? Wonderful. Wonderful. Let's talk about this. Check the urine output. Let me tell you why you're going to check the urine output. And you even had a hint. In the question, it told you that the patient was dehydrated. Whenever a patient's dehydrated, we're going to be concerned about the kidneys, all right? They're dehydrated, you're making the kidneys work a little bit harder. That was your first clue. But even if I didn't put in there that your patient was dehydrated, I didn't give you that clue. All I told you was that that patient was getting KCL. What's going to be your priority assessment is still going to be checking that kidney function, checking the urine output. Why? Because potassium can kill you. Remember? It has a very narrow therapeutic range. It can kill you. We have to make sure that that patient's kidney is working properly, that that patient's able to excrete this medication that we're about to give them, because God forbid those kidneys are not working. That patient's not urinating the way that they're supposed to. And that medication is building up, is building up, is building up. And now we put our patient into toxicity. Right? So we're going to make sure that the urine output is at least 30 mLs per hour. We got to make sure that the patient's going to be able to excrete that medication. I saw 29 of you guys chose blood pressure. Whenever a patient's getting fluids, you always want to watch the blood pressure because you want to make sure you push a patient into fluid overload. I get it. But when it's between blood pressure and checking the urine output, again, let's go back to the medication. Remember what I told you guys. You see this KCL? I told you the patient was dehydrated, and I told you the medication we're giving. Whenever you get a question about a diagnosis and a medication, do not be distracted by that diagnosis. Pay attention to the medication. The diagnosis may help you, it may give you a clue, but what we care about is that medication. And one thing we know about potassium chloride, we are not going to give that medication if the patient's kidneys are not working. We are not going to give that IV fluid if that patient's not urinating, because they're not going to be able to get that medication out of their body. Okay? Select all that applies. Which is not a complication of diabetes mellitus? Select all that applies. Which is not a complication of diabetes mellitus? Here are your choices: cardiovascular changes, hyperglycemia, slow wound healing, microvascular changes, increased perfusion, increased gas exchange. Which is not a complication of diabetes mellitus? Yes, Sunny, this is Kahoot. Okay, let's talk about it. There are only two correct answers here, and it's increased perfusion and increased gas exchange. Unfortunately, diabetes mellitus affects every single organ structure that you can think of, right? So you're going to see cardiovascular changes. You're going to see hyperglycemia. You're going to see wound healing, because let me tell you something. Pathogens, bacteria love a wet, moist, dark, sugary environment. That's where they thrive. So you're going to see wound healing. You're going to see microvascular changes. Patients going to have kidney issues. They're going to even have issues with their vision. What you're not going to see as a complication to diabetes is increased perfusion. Increased perfusion, that is a good thing. Perfusion is how much those tissues and cells and organs get all of the oxygen, vitamins, minerals, nutrients that they need to survive. Increased perfusion is a good thing. That is not a complication of diabetes. And increased gas exchange, that's a good thing. That also is not a complication of diabetes. So those are the two correct answer choices. And I seen 26 of you guys chose microvascular changes. Guys, think about the tiny, tiny, tiny little vessels you have in your eyeballs. You don't think diabetes affects vision? You know, I don't even know the number, but I could tell you millions of diabetics, they lose their vision from diabetes. Absolutely microvascular changes. Select all that applies. Your patient has PKU. You know, I'm not going to try to pronounce that word, but you see it, PKU. Which clinical manifestations would you expect to see? Here are your choices: digestive problems, seizures, cognitive disturbances, eczema, musty odor in the urine, hyperactivity. Which symptoms would you expect to see? All of them. All of them. All right. So phenylketonuria, PKU, this is a disorder where the patient's missing that gene that actually breaks it down. And so if the patient eats foods that has this, they can't break it down. And so they get toxic levels. And toxic levels of, it's called, I'm going to tell you guys what it's called. I cannot pronounce, phenylalanine. I'm pronouncing it. I can write it. I just can't pronounce it. But anyways, phenylalanine. I think I said it. So when you get toxic levels of that in your system, it mostly affects like your CNS, but it affects all of them. You get digestive problems, seizures, cognitive disturbances. Matter of fact, these three we see more with much higher levels, but you also can get eczema, musty odor in the urine, and hyperactivity. So all of those are clinical manifestations of PKU. Select all that applies. Your patient is dehydrated. Which symptoms would you expect to assess for? Select all that applies. We're looking for signs and symptoms of dehydration. Here are your choices. We have tachycardia. We have flat jugular veins, increased urine output less than 30 mLs per hour, distended jugular veins, thirst. Let me move the camera for you guys a little bit on the live so you can see the other side. What do you guys think? Select all that applies. What would be those signs and symptoms of dehydration that you'd expect to see in your patient? Tachycardia, flat jugular veins, increased urine output less than 30 mLs per hour, distended jugular veins, thirst. Oh, I spelled jugular wrong. Sorry, guys. All right, let's go through them one by one. Move this aside. Tachycardia, because your body is such an amazing design. Your body is going to try to survive no matter what. So your heart's going to try to compensate. You're dehydrated, perfusion's decreased, your heart rate is going to increase because it's going to try to push out fluids that your body's screaming for. Okay, that's why you're going to see the tachycardia. Flat jugular veins, of course the jugular veins are going to be flat. There's no fluid in there, right? If you were in fluid overload, it'd be the opposite. You'd have distended jugular veins, but because you're dehydrated, they're going to be flat. Urine output less than 30 mLs per hour. Again, your body's going to try to survive no matter what. So if you're dehydrated, your kidneys are going to shut down. Your kidneys are going to try to preserve the little bit of fluids that you have left so that your major organs can be perfused, such as your brain, your heart, your kidney, your spleen, right? And last, thirst. Of course, you're dehydrated. Your body's screaming for fluid, so you're going to be thirsty. What you're not going to see is increased urine output. You're already dehydrated. You don't have enough fluid. You're not going to be losing more by excessive urination. The urination is going to decrease, not increase. And remember, normally we want to see at least 30 mLs per hour in the patient. And you're not going to see distended jugular veins. Again, distended jugular veins, that's something you see in the patient fluid overload, not fluid volume deficit or dehydration. Select all that applies. Your pediatric patient has a fever. Which nursing interventions would you include? Again, select all that applies. So here are your choices. Remove extra clothing and blankets. Provide a sponge bath with ice water. Administer aspirin as ordered. Provide IV fluids as ordered. Administer acetaminophen as ordered. Increase the patient's room temperature. Which nursing actions would you perform for your pediatric patient that has a fever? Those of you who just joined the live, welcome. Just go ahead and put your answers on the screen. This is going to be interesting. Okay. Let's talk about this. Let's go through them one by one. Your pediatric patient has a fever. Their temperature is already high. So we want to remove extra blankets and clothing. Correct. We're going to want to give them IV fluids because as that temperature goes up, they're going to be losing what? Fluids, right? We don't want them dehydrated. Yep, we're going to give them IV fluids as ordered. And yes, we're going to administer acetaminophen. Acetaminophen, that's Tylenol. You're going to give that as ordered. Absolutely. Here is what we are not going to be doing for our pediatric patient. Providing a sponge bath with ice water. Let me tell you guys something else. I don't care how beautiful that answer choice is. If there's one word in that answer choice that's wrong, the whole thing is wrong. As much as it pains you to get rid of it, get rid of it. Don't choose it. I put this on purpose. Why? Because I know the minute you saw provide a sponge bath, you jumped on it. You're like, yes, but look, it said ice water. With what? Lukewarm water, not ice. Next, what are we not going to do? We are not going to give any child aspirin. Remember, this is a pediatric patient. So even though we know aspirin can work as an antipyretic agent, it can bring down the temperature. Because we're dealing with a pediatric patient, we're not going to give it. And look, I put as ordered on purpose. I don't care if the healthcare provider ordered it or not. I'm not going to lose my license because they told me to do it. I know better. This is a pediatric patient, and we do not give aspirin to pediatric patients, except in certain situations, something like Kawasaki. There's very specific situations that we would give aspirin. But 99% of the time, and this isn't one of them, you are not going to give aspirin to a pediatric patient because you can cause them to have Raynaud's syndrome. So we're not going to do that. And last, increase the patient's room temp. They already have a fever. Their temperature is already increased. Why would you increase the temperature in the room? That doesn't make any sense, right? All right, let's keep going. Your patient just had a thyroidectomy and you note that their voice is hoarse and weak. What's your priority intervention? Is it going to be to check for signs and bleeding? Is it going to be to administer calcium gluconate? Is it going to be to notify the physician immediately? Or are you going to teach a patient that this usually happens and it's a temporary condition? What are you going to do? Your patient just had a thyroidectomy and their voice is hoarse and weak. All right. The correct answer is teach them that this is normal condition. I saw 20 of you guys chose check for bleeding. Okay. Their voice being hoarse and weak, that is not a symptom of bleeding. Think about it. They just had a thyroidectomy. Your thyroid gland sits right here. They just had surgery right here in their neck. It makes sense that their voice is going to be hoarse and weak. And you're going to teach them that it's going to be like that for a couple days. Now, if we're looking for signs and symptoms of bleeding, let me tell you what we'd be looking for. Constant swallowing. You see them, they keep gulping. What do you think they're swallowing? Blood, right? So that would be a sign and symptom of bleeding. Or you look at the labs and you see the RBCs down. Where are all those RBCs going? Why is it down, right? You see increased heart rate, decreased blood pressure, decreased urine output. Now, those together would be signs and symptoms of bleeding, but not a hoarse and weak voice. That's normal for the next couple days. Next, 4 people chose administer calcium gluconate. So let's talk about that. Your patient had thyroid surgery. They had thyroidectomy right here. And you know those 4 little nodules, those are the parathyroid gland. There's a big chance while they're getting thyroidectomy, you know, that parathyroid gland was nicked. You know the parathyroid gland is responsible for calcium, right? So there may be a chance it could happen, right? When would we give calcium gluconate? We'd give calcium gluconate if the patient was hypocalcemic. What are the signs of hypocalcemia? Obviously, you'd be looking at the lab. You see the calcium was low. You may see what? Tetany, Trousseau's, Chostek, nerve muscle irritation, things like that would let you know, okay, maybe the patient's hypocalcemic, but not hoarse and weak voice. That's not a symptom of hypocalcemia. Next, notify the physician immediately and tell them what? That the patient's voice is hoarse and weak after they just had surgery in their throat? Come on now, right? And let me say this to you all as well. Whenever you're tempted to choose the answer of call the physician, say to yourself, do I have enough information to call the physician? Which means, have I assessed the patient enough? You're going to call the physician and say, the patient you just did surgery on their neck, their voice is now hoarse and weak. And the physician is going to say, okay, what do the vitals look like? You're going to be like, come on. No, you have to, before you call the doctor, you call the healthcare provider, the nurse practitioner, whoever, make sure you have the necessary information that you're going to have to relay. So the correct answer is let them know that this condition is temporary. Your patient is in diabetic ketoacidosis. Which assessment findings should you expect? Would it be sweating and tremors, hunger and hypertension, Cold and clammy skin, or fruity breath and decreasing level of consciousness. Your patient is in ketoacidosis. Which clinical findings would you expect to see in your patient? That's right. Fruity breath and decreasing level of cognition, where they can become confused. That patient might even go into a coma. All the other choices are signs and symptoms of hyperglycemia. If the patient's hot and dry, their sugar's too high, and if they're cool and clammy, you better give them some candy. True or false? Aside from increased temperature, diaphoresis and flushed skin are assessment findings for the patient with fever. So, besides having an increased temperature, would you expect to see diaphoresis and flushed skin in the patient with fever? Is that true or is that false? Yep, true. What do you think they're sweating from? They're sweating from that high fever they have. Very good, true.